Eric is dressed all up to give us a professional talk today.
I am really dressed up for a podcast. I'd like everyone to think that I wear a suit when we record these. No, Tiffany, every once in a while, dressed up, dressed for success. Um, no, well, we are going to continue our discussion around financial trauma. So again, just our trigger warning for this episode, we will be talking about financial topics, but we will be kind of merging things we've discussed before here on healthcare trauma. So I do just want to give that warning today that if you are not in a place to hear maybe information about financial trauma or healthcare trauma, uh, maybe come back to this one or skip this one, or maybe just tread lightly. I think everyone, if you're listening, kind of knows that Tiff and I kind of weave things in. We don't try to go for shock value, but we just try to have some organic conversations about things. So that's kind of what I have on the docket for us today, Tiffany. And I'm excited about this one. I think you and I both have had many clients with healthcare trauma that also shows up maybe also as financial trauma or financial trauma that shows up as healthcare trauma. So I know it's a very hot topic in the therapist community.
hmm
And there's a lot of discussion about it of, you know, how do we not add to that burden, but also how do we charge for these services and services people need, and it gets into like the healthcare system, and this gets into things very quickly. So you might have heard me stop myself last recording because I did not know, just to think that you could go into so many things within healthcare trauma, financial trauma, but we're excited to get into some of this today.
Also, sensory warning, I'm eating breakfast, so if that bothers people with sensory issues, I'm just letting you guys know.
Well, we're covered. Sorry, I'm laughing. Tiffany like gave the warning like I'm eating breakfast, then like took a drink of her Coke.
I just want people to know I sometimes people can't handle like people making mouth noises, so
Well, that was kind. No, no, no. I just thought it was funny that you um drank your Coke immediately
Coke for
after giving the
breakfast.
heads up. You know, we're not sponsored. Not sponsored.
And to
Okay.
be honest, it's not Coke, it's Poppy.
I looked too quick. It just looked like a red can.
I
I've
know.
been
It is deceiving. It's
marketing
deceiving.
marketing's impacted my brain. Um
I'm
Look at
not a
me
Coke
go.
fan.
um I love that. So when we're talking about healthcare trauma, we are talking about maybe things like COVID is a really clear example of this, of maybe individuals who worked in healthcare, and so they're feeling like healthcare trauma from COVID. There's a wonderful show called The Pit. It portrays it really well. Dr. Robbie is a ER doctor who works in the unit during COVID, and they show how that's impacted him. I have the privilege of having many friends in healthcare. They carry those scars uh, and wounds. Um, Still to this day, and that can be very challenging for them still. And so that's some examples of healthcare trauma. An example of maybe a client with healthcare trauma could be having a very intensive procedure. So if we just stick with COVID, having long-term COVID, being hospitalized for COVID, losing a loved one or a friend or family member to COVID, those could all be experiences. But we could get into more types of healthcare trauma, like maybe bias showing up in healthcare, maybe being asked questions that don't feel trauma informed, um, like, "Oh, really? You're still smoking?" Or,
Mm.
"Wow, you do this or that." That's common for some of my folks in recovery, if
Yeah.
that's in their chart, or showing up from alcohol and addictions, uh, like them just kind of feeling like they're being treated as an other. Sometimes it's just even like really unf- just bigoted questions about like, is that your brother? No, that's my husband, type of thing. Um, so there's still a lot of different types of examples. So I thought, Tiffany, it's probably helpful if we talk about what healthcare trauma actually is, because I think we need to know that context before I think we bring it into the financial trauma. So anything you would add to that?
I think just how um abrasive it can be, even with you talking about it, where I think I'm at a loss for words of just like how I even had gut reactions having to go like you talking about how people react um in terms of just people being very dismissive of other people's experience because of, and I don't want to speak for every healthcare provider, but that where doctors can be dismissive, healthcare providers can be dismissive because they feel like they like know what is quote unquote right.
Yeah, maybe that authority approach of coming in of like I am the superior opinion or mindset, and there are lots of stories and experiences where folks have not had their experiences honored, to the point where maybe I think of women with pain, and like their treatment under treatment for pain, maybe not having symptoms recognized as something significant when it was. Um, yeah, there's lots of interesting discussions, which makes me want to think about bias in healthcare and trauma. But again, you can kind of see where we're going with this if you're listening. Like, there's like, I think once you get into financial, so it's interesting we're doing this through financial trauma, but like it really connects. And we're talking about healthcare trauma, like it really connects things. So you could see Tiffany and I kind of going this. It's all very interconnected, and so I think if you're listening, you're like, wow, they just keep jumping around. It's like, well, it's very hard to talk about one of these types of trauma and not understand the connection to other types of trauma, uh, and your body and nervous system. Tiffany can correct me. Doesn't really know. Oh, well, that's the financial trauma, or oh, that's the medical trauma. Like it just knows it's trauma, and so it's
Yes.
like your trauma is going to connect with your nervous system, your body, your brain, and like that's the filter that it's going to go through. So it's very, 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 very difficult to separate, even I think to discuss. So
Yes. I always tell people like A plus B equals C in your brain. Like if you have A squared plus B squared equals C, your brain, for whatever reason, I am not an expert, but it goes, these little squares up here don't matter. This A plus B equals C no matter what. I don't care who's involved. I don't care how A is different. A plus B equals C. And it's usually a relative behavioral trigger plus a relative emotional experience equals like our nervous system, survivor system, trauma thing. Our trauma is triggered and we go into fight, flight, freeze, and fawn.
well said. Well said. Um, so I think this is a good background to give a little context, not get maybe too into the weeds on some of this, but to just give some context of like why we're going to talk about financial trauma as healthcare trauma. So we've discussed financial trauma at length last time, but to those who maybe, I don't know, maybe skip that episode and you're here, financial trauma could be those stories or narratives that we have with money or things we've gone through, hardships. It can be many, many different types of things. So that could be growing up, not knowing when the next meal is going to be there, not knowing if you're going to be able to have school fees covered. Um, my father has a story. I don't think he would mind me sharing this, but when he was growing up, family of five, pastor's kid, one job, rural Pennsylvania or rural Iowa, one of the two. And, when back to school came and there were the tissue boxes and like bring some tissues to school for supplies, they brought toilet paper rolls because that was what his family could afford to bring in. And they were sent back. And so my dad tells the story of like that feeling. And so very may seem like a very insignificant thing, but another person example may be like having groceries and then their card gets declined when they're at the checkout, or insert thing, that pressure of are we going to be okay? Is this going to be enough? Feeling like you can't get ahead. So there's different things that can be related to financial trauma. So we talked, I think, for a good 40 minutes on that last time. So don't mean to go into repeat, but
Mhm.
where
But I
we
think it's a
see,
good reminder to give a perspective of like what that can look like outside of the healthcare field as well.
yeah, I mean, I think Tiffany and you and I were talking about, like, I think I shared, like, I knew when I was in grad school. And so I have a lot of privilege because I chose to go to grad school. So I'm checking myself before I go. But in grad school, I was broke as a joke. And I knew the hour and the minute that the Kroger in Muncie marked down their produce. And you want to hear something kind of silly? This is where I could tell the survivorship is still in me. I've never told anyone other than my roommate at the time, because we were surviving together, what the time was or the day. I'm like sitting here and I'm still like keeping it to myself as if I'm going to go back to Muncie, Indiana, and you know, even like it's the same. But isn't that interesting? I'm like, I could tell there's still this must, survive and adapt and overcome. But no, I think you're right, Tiffany. It's good to be real. It's good to give real examples, and we want to give some of those.
Mhm.
When we talk about medical trauma showing up as financial trauma, so I you'll have to understand. Like, well, I'm gonna check myself. I'm working in the mental health space. I worked alongside other people in the medical space, but there's just this idea of like you go to an inpatient stay. That's awful. That's horrible. You're at one of the worst moments of your life. And then insurance isn't usually covering all of that, especially if you don't have Medicaid. So you're getting out, you're trying to get back to work. And some people haven't gone through this experience. So I wanted to just be upfront. Like, I know some folks maybe listening have had this experience. So I'm not really trying to explain it to you. Like, you've lived it, you know what this is like. But some folks have never been inside of a mental health institution or treatment or a 72-hour hold. And I don't think they understand what it looks like. So your life has been on pause for 3 days. You're not going to have a phone. You're going to be kind of disconnected from the world very intentionally so you can focus on yourself and mentally get right. But
Mhm.
for many individuals in that situation, they're trying to work. I mean, and I'm talking about people who are struggling not to attempt harm to themselves, maybe others, not in the right frame of mind. A very valid and real concern that is becoming more and more of a concern as we have economic issues and the world around us with insurance is, how am I going to pay for this? And so I have legitimately sat as a crisis counselor, and everything else, like the person's willing to go to treatment. They know they need to go. All other things are yes boxes, green check marks. And the one that usually stops people is the finances. It's the, I'm still paying back my last time in the hospital. I can't afford to go back and do this again. I have no time at work. I'll lose my job. I'll lose my house. I'll lose my car. I can't do it. I can't do it. And if you're wondering, what do you say to someone in that situation? You kind of just honor that that's a very legitimate fear. And if we're going to talk about Maslow's hierarchy of needs for just a moment, some of you may know what that is, some of you don't. There is a kind of pyramid of sorts of hierarchy of needs that is kind of like the way we approach life. And at the very bottom, physical, is there. So that's housing, that's shelter, that's transportation, that's food, that's medications. And above that is kind of mental well-being and emotion. So why that's important for us as counselors, and Tiffany knows exactly where I'm headed, is if you can't take care of those needs, your emotional needs will not matter. So if you don't have a place to stay, you don't have food in your belly, you don't know how you're going to take care of yourself, you're not going to be able to heal your trauma.
Mhm. Yeah, you are just going to be stuck figuring out, how do I cope with and live with this trauma in a way that like allows me to continue to survive.
Yes. And so some people say, well, that's ridiculous. That should be the system. Let's fix it. But it's not really as simple as that. These are expensive. I mean, and I'm not defending insurance. Don't hear me say, like, there are, this insurance came about because there was a need to control cost and try to go, because there were people, maybe whatever, misuse. But now we are in the system where like it's very little misuse, if any. There are people who are legitimately having so many barriers to getting treatment. And this is just if like we're talking about things that are covered, not to mention if it's like you feel like you need a service or a thing and insurance says you don't, and then you're not covered, which is becoming more and more of a unfortunate experience. So that was one of the stories I wanted to make sure we kind of told. I'm aggregating some stories, but the person who needs to go to a mental health treatment center to heal and reset can't afford to do so, and then is continuing to be in this place of unwell. There's also this gap in healthcare that I'm noticing. We could talk about access to healthcare, which is like location or ability to pay, but there's this gap in healthcare of if you are lower on the scale, you should be able to qualify for things like Medicaid or different types of assistance to get healthcare or different programs. If you are high SES, you're not going to worry about things like healthcare costs as much. You can pick and go wherever you'd like to go. Um, and you have so much access and choice. So the gap I'm getting more and more concerned about is maybe what I would define as whatever you would put the middle class in, where you do have to pay for your healthcare, whatever that is, a high deductible plan or marketplace plan or a workplace plan. And these plans are getting more and more expensive. I believe the average healthcare premium for even just corporate organizations, it's like something like 20% raise on like the cost of healthcare in the last year. So that's
A lot.
intense, but it is. I mean, that's a shocking number. I mean, most people I know are like, "Hey, I got a 5% raise this year. Woo!" Uh, that would be awesome. Or most of us are just hoping to keep up, right? Well,
Mhm.
how are you going to keep up if the healthcare cost is raised 20% and then that gets passed directly to you? I mean, and so I'm trying to come from
It
the
makes my stomach hurt thinking about that.
yeah,
How much extra cost that is passed down to the consumer.
yeah. I mean, we need a different system. And so if anyone's listening, like, don't defend, I'm not trying to defend the system, but, Tiffany and I have sat with many people and we become healthcare advocates, honestly, in therapy sometimes of like, okay, this is how you could do this, giving information because people don't know. Um, there was a situation with my daughter where she needed to get seen for glasses. She's okay right now, but I'm going to be upfront. And I've told some of my friends this story. I'm not trying to attack my field. I would never put up with what it's like to get a counselor these days, to be honest. That I was able to call insurance referral, boom, done, find them, go in, and get the service that was very straightforward. Therapy, you've got to go through all these different do you go to this system? Do you go here? All the names. Like, I mean, there's so many different names and like to the us therapists, it makes perfect sense. I'm gonna make fun of myself. My practice name's Empowered Change Healing. It was easy to just Google children's or eye care and go. If you search therapy, lots of things come up, and there's this physical in and out done. This is kind of related to health financial trauma, but it's just so complicated and it's so expensive. And a lot of us therapists, we don't want to take certain insurances. They reimburse really low. They put a lot of the burden on us as providers to justify the care. If we're taking insurance, we're all afraid of clawbacks. So no therapist in their right mind who cares about a patient is fraudulently giving therapy. Um, but like therapy is supposed to be very dynamic, engaging, needed, and then when it's not needed, done. So like for us therapists to just try to find things or fill things to talk about, that's exhausting. Like it's not what we want to do. That's not why we got into the field. Sure, there's a few bad actors, but there's a few bad actors in every field. So if us counselors are taking insurance, we face all this extra work that we have to deal with simply because we're taking insurance. So this is my defense of us counselors, Tiffany, for just saying. So counselors are leaving depaneling off of insurance panels if they can afford to do so because it's so burdensome, it's so complicated. You have to hire an admin person just to deal with the insurance companies, the reviews, the chart audits. And yeah, it's great to have checks and balances, but it means that lots of providers who are amazing, amazing healers, seriously amazing, no one has access to unless they're going to pay out of pocket. And that
Mhm.
group keeps getting tighter and tighter, in my opinion, Tiffany. And that's what I'm seeing and hearing from my friends of less and less people are able to even say, this is a temporary investment in myself. Let me go do this work, or you're the best fit. And honestly, my empathy and understanding for that process grows more and more every day because it is getting harder and harder just to survive
Mhm.
for mostly everyone. Um,
Yeah, and as someone who decided to take on the insurance companies to allow some access in and out of my practice, it has been atrocious. they like don't answer you. I've spent hours and hours and hours on the phone just trying to like figure out if there's coverage. And sometimes they'll give you numbers and you will submit claims and the insurance is like, yeah, no, that's actually wrong. Like, and then you're kind of the face of like, I'm just trying to provide care for someone who wants care. That you told me that I'm supposed to be able to accept your insurance, and now you're like screwing over the client because you can't give a straight answer.
Yeah. I realize, I mean, we're talking about some of our financial trauma, but also like the mental health space. And it's just rough. It's just rough. Like, I
Yeah,
think this work is very intense, very tough. And to be honest, it is not the most financially lucrative thing for the level of training, commitment, ongoing education. Um,
we
yeah,
don't
there's
do our
just so
job for
much.
money.
No, no, I mean, we
um,
sure don't. I mean, this, for those listening, I don't like when Tiffany and I are in some different therapist groups, and my whole thing is like, I want us to be able to have a good housing, a reliable car, a future to retire, and meet our current needs for our families. That's it. Like, so I'm not talking a Porsche. I'm not talking mansions. I'm just talking that and paying off our loans, like our student loans at some point, because almost every counselor I know has student loans. So, and Tiffany, if you can't see Tiffany's face, her face is
you're
shrunk.
fine. I know I'm laughing out of pain and torture because I've accepted just not to get like super into the financials, but based on what I make, I will never like at this point, if I keep going the path I'm going, I'm not gonna pay off my student loans. It's just not feasible to live and pay off student loans without drowning or having a partner. God forbid you're alone in this
Yep.
field, and it's just like I I don't know how.
Yep.
Yeah.
Nope. So that's real life. So I thanks Tiffany for being open and sharing. When I give that pitch, that spiel I have about what I want, and it sounds like I'm running for an office because almost none of the counselors I know have that or feel like they have that. And so then it turns into how do you grow these skills so you can go to private practice and charge these rates? And that's been a path for a long time. Or how do you start your own group practice? But it's getting tighter and tighter. So there's that playbook is there will always be group practices, there will always be community mental health, there'll always be things, but it's just getting harder and harder to survive. Whichever system you're going into, it's just getting
Hmm.
harder and harder to survive. And I think people are feeling this pressure. But to Tiffany's point, legitimately, if you don't have a partner who can put you on their insurance, I think people are living this and know where this is going. It's horrible. Those market rate subsidies for marketplace insurance plans killed a lot of my friends' incomes overnight because they are now having to pay this very expensive rate for healthcare insurance because of the way healthcare insurance is tied to employment in this country. So there's just a lot going on all the time. And then other situations come up and this gets complicated is change of job. So you're going from Anthem to United at this job. Maybe your providers don't take that insurance, or maybe that one covered this, and now they're reviewing your medications you've had for oh man, Tiffany. I mean, all my neurodivergent folks, like, yeah, I've had this medication for 10 years for ADHD, switch jobs, new insurance, and now
Now
they're
they can't
asking
get
me
it.
to do, yeah, can't get it, deny. And there's the playbook, deny, repeat, delay.
Oh,
And
and to like compound that, I'm sorry to interrupt, and like my brain just like light bulb, like an angry light bulb of just like whenever you have those individuals, neurodivergent individuals, or any individual who has a mental health diagnosis, when they're trying to get like life insurance and quotes of that nature, when those are put up and people will use that as excuses to like charge them more because they quote unquote have financial like that mental health that wellness things that they have to like charge them more for. Like that is traumatic too. I can imagine to get an email and say like, "Hey, because you have X, Y, and Z health or mental health problems, we're charging you 30% more."
yeah, no, it incentivizes people to not want to be truthful about their healthcare. Um, Lord.
Yeah. it's really frustrating, like, just how much the healthcare system just it seems to be set up to work against the whole purpose of what it should be doing.
Well, the number one cause of bankruptcy in the United States is medical bankruptcy. It has been for a long time, and I would argue that number will increase. You know, one way folks may be trying to save some money is go to a high deductible plan, which can save you on premiums, but then you're having coverage for nothing, almost
Mhm.
nothing until whatever that certain point is. So I'm not trying to like mansplain insurance today. I just think like there's just no good solution. Um, so I have focused a lot on mental health situations, but I've also had folks with like substance use recovery. They've gone for treatment, lost their jobs, can't pay anything, lost access to things because they really did need to go to be well and heal, but then it feels like a punishment um, when it's not intended to be. Um, so it just makes me sad. I'm slowing down because I'm just honestly sad that that's the situation that people are dealing with. So I just want to honor all those experiences because like I just think like it's real. I mean, I know people who are delaying procedures, like medical procedures, because they're not wanting to face another bill. Like that's another challenge. Or, we're I know folks who are traveling out of the country because it's cheaper, even with insurance, to pay out of pocket in a whole nother country, travel, hotel, and then come back than it is to
That's
pay for a
crazy.
procedure
That is just
themselves. Um, and I won't give too much information because I want to protect the folks that have shared that information with me. But like, different countries, you could Google different types of procedures will ping to different countries, but it's becoming a whole industry because our healthcare system is so
fucked up.
fucked up's the right word. Um, so yeah, I feel I don't want to try. I'm not going to put a band-aid over this pain. I'm not trying to put a rainbow over this, but I do think this is very, very heavy. Like I feel it. So I do just want to say there are some really wonderful things that communities have been doing. Like certain nonprofits will buy up a certain percentage of medical debts that have been sent out to collections or is be going. So it's like I think it's like they spend $100, but they grab like $10,000 of medical debt forgiveness, something like that. It's a huge factor. So some churches that have done that in Cincinnati, even where some nonprofits have done that, and it has this huge impact because it's like it's clearing up different things for individuals. It's just there are some positives. There are some organizations we're trying to have conversations, but I think Tiffany, we want to destigmatize this conversation. Like this is what makes me sad. I've had many people feel like they failed at life because they don't own a house or they don't have the car they thought they should have, or they haven't gone to this. And it's like they went to college, they did this, they did that. I would argue they've not done anything wrong. Just the game got much harder. I think you said this here, Tiffany, like it's like you're going to the legendary mode, it's not on normal, it's on like that. So it's
Mhm.
just harder to do all those things. It's tighter. It's much,
Yeah.
much tighter.
I don't know. I wish I could pinpoint exactly where, but someone somewhere in the system said, "You know what? Life isn't hard enough. Let's just ramp it up a little bit." And I just was like, "Well, damn, this kind of sucks." It's one of those things that's really frustrating too, where you have the people that have quote unquote completed the game of life, and they're like, "Well, it's not that hard when I was doing it." And I was like, "Well, you're not. It's changed. It's a whole different game now. The game that you played for life like doesn't exist."
Yeah. So I think whatever this is worth to folks, if you have healthcare providers and it's trusted, have that conversation with them of like, hey, I don't know if I can afford my meds this month. Like, and I'm like, just be real about those concerns. Like maybe there is something, I'm not trying to tell people, but maybe there is something that's pretty close. There's like, if we're trying to control cost, or maybe your provider could space out something, but I would say if there's any help, I don't think there's a single healthcare industry, whether it's dental, eye care, put whatever thing that's not having more and more of these situations and conversations happening, and that doesn't mean you're doing anything wrong. So I would just say just talk. If someone's judgy or not understanding, like that's probably another thing to know. But I would just say that most people are looking for affordability and understanding. And so just trying to holistically take care of yourself is very difficult. But let's not gaslight ourselves that if you faced a medical condition that wasn't your fault, then let's not put that blame on you. You know, like you didn't spend your money poorly. You got a medical issue. We could go on and on. I mean, I think about like how ableist this system is and how like many folks are not ever going to be able to retire or afford to retire. Think of the
Mhm.
heartbreaking story of the 88-year-old Walmart greeter who like
Yeah.
or the DoorDash. I mean, it's like it's sad that like it's like which one are we talking about because there's more and more so our system
Mhm.
is fucked. There's no nice word for it. And we got to keep advocating and finding ways to improve. But I could see us coming back to this, Tiffany, honestly. Like I really could I think we could continue having like a series of these conversations. But I think for my excuse me, my own wellness, I think I need to be maybe landing my plane and pausing because I'm getting very worked up. I'm getting very sad about this because it's just it's all the stuff that sucks in our system, even though I'm trying to bring up some of the positives.
Yeah, it is a really heavy topic because even with the positives, it's just so much negative. It's so much you're navigating like a minefield, and at one point, someone is gonna hit a mine. Um, it's this really stressful situation. So much so that I imagine and know that some people get locked in that like, oh, do I really need to go to the doctor or will I just be okay?
That's scary, isn't it?
That is really scary that's the place that uh, our system and the way it works it puts people in to where it's like and I mean you see it now where people and not to shame these people in any shape or form like people got to do what people got to do to survive. But where people go to work sick because they're like, well, if I don't show up to work, I like get pointed or like it counts against me. And if I have so many counts against me, then I get fired because the system just doesn't offer like flexibility for people taking care of themselves. Like the healthcare trauma extends so far into other things that it's hard to avoid.
Wow. It is. Yeah. Is there anything, Tiffany, that you want to add to this?
I think just being kind to yourself, like in navigating this really difficult, stressful healthcare landscape and recognizing like it's not easy. Definitely not easy. Is there any tidbits or quibs you want to leave with us as we wrap up today?
Just hang with us. If you're feeling some of these concerns, like I think many people are, like just maybe stay in the conversation with us. And yeah, I'm just it's interesting. Like, and that's I guess just take boundaries and take space. Like I'm like, okay, I think I need to be done with this conversation, even though Tiffany's one of my bestest friends. Like I'm just like, I need to be done because like I can tell that it's just like interesting. Yeah.
Hmm. Yeah. Well, that is us wrapping up for the day. We appreciate you for joining us in this really difficult conversation, and we will see you guys next time.